Good evening. I'm Hartford Healthcare's Tina Barona. Thank you so much for joining us for another live Facebook discussion. Well, the lives of people living with mental illness are often plagued by stigma, even discrimination. It's an unfortunate reality. Joining the discussion tonight is Pat Rehmer. She's the Senior Vice President of Hartford Healthcare and President of the Behavioral Health Network. Pat, thank you so much for joining me. This is an important topic.
Yep.
Let's dive right into stigma first.
Okay.
Mental illness is a disease, much like cancer, but yet the two are perceived publicly so very different. Why is that, and how do we even begin to get past that?
It's a very good question. I mean, I think that part of the issue, again, in my opinion, and in the work that I've done, the stigma is more about people, how they feel about themselves. There's a lot of shame that's associated with substance use disorders or with mental health issues. And so people feel that internally. My feeling and experience is that how we treat those individuals is really discriminatory, whether it comes to housing, jobs, just how we interact with people, if they're our coworkers. It's just very different.
And the perception is that this is an illness. It's not just someone conjuring up thoughts or it's an illness.
Right. It is not just, it's the old, when people were depressed, you would hear people say, pull yourself up by your bootstraps. Well, It's not that easy.
Right.
If you have a substance use issue, somebody, just put the drink down, stop using those opioids. It's not that easy. There are brain changes that actually occur and that we need to either provide treatment for, or in the case of substance abuse, sometimes people find different ways to recovery. But again, the brain changes back don't occur for about 90 days. And so it really is about, this is an illness. It is an illness like cancer because it's a chronic, often recurring illness, actually maybe more like diabetes. And yet, as we like to talk about, where's the casserole? If you have another illness, you have people bringing you food. I was out for about 6 weeks after surgery. I had dinner brought to my home every single night for those 6 weeks. If somebody goes in for treatment for a mental health issue into a psychiatric facility or an acute care hospital with a psychiatric unit, it's not talked about as much. It's very much sort of kept within the family still often, although we are seeing some changes with the recovery community really helping with that, I think.
And hopefully a unique sponsorship Hartford Healthcare, the Behavioral Health Network, has with TheaterWorks to sort of bring this issue to light is a musical, a Pulitzer Prize, Tony Award-winning musical called Next to Normal. It actually begins this Friday, March 24th, and extends all the way to April 30th. And this is a musical about a seemingly normal family on the outside, suburban family, and a mom who grapples with issues of bipolar disorder, and then it trickles down into opiate addiction with the daughter. I mean, this is sort of everything in an hour or 2 hour musical.
Right.
Pretty heavy stuff.
Yes.
Talk to us about the role of the individual affected and then the family affected, that perspective.
I think that the musical itself really does help focus on the family dynamic. I think that people often think that these issues come up sort of in a vacuum and that there's nothing that the family is necessarily going to do or change that will help, when in fact, for example, substance use disorders are really considered a family disease. And so if the family is not included in the treatment, we don't see the outcomes that we would like to see. And I would say the same thing with a bipolar illness, which the mother in this show has. If you don't get educated about it, if you don't know what to expect, if you don't know how to access the system, it's very troubling for families. And even after somebody's in treatment and well into treatment, I think that involving the family in that and ensuring that they understand what the issues are that perhaps this individual is facing, and it's different for everybody, this is very individualized, is really important. The family inclusion is really critical.
And especially for this particular family in the musical, and like many families out there, everything is normal on the outside. So the stigma for them is, well, we have to portray this persona. Nobody can know what goes on behind closed doors.
Right. Right, and I think the title is telling in this show too, because it says next to normal.
Right.
Well, what's normal?
Right.
What does that mean to people? We still all have these fantasies that every family except our own is this perfect family that's having the perfect holidays and all very happy, and really that exists. I don't know that exists anywhere.
Right.
And so to continue to believe that only furthers, I think, people's desire to keep this very close to their families and in the house and not outside the house.
And when we talk about families, and we talk about mental illness and addiction issues, is this genetically related or hereditary in terms of families that you can see it, just much like breast cancer? You have a family history. Is it the same with mental illness and addiction?
It is. Certainly with addiction, we know that there's absolutely a genetic component. And I always warn people that if you have come from a family that's genetically loaded, that has parents, grandparents, aunt and uncles who had a history of alcoholism, for example, you really need to guard against that yourself and monitor your own drinking at that point.
Right.
And with a bipolar illness, we know there's a genetic component. So I usually, in my experience, have seen people who have an aunt or perhaps another family member. It doesn't have to be in the immediate family that did have the issue. The thing about that now is that we probably will hear more about that as we move away from discriminating against these disorders, because often what you hear is, well, I think I had an aunt that seemed to go in and out of the hospital, but people don't even necessarily know what the diagnosis is.
We're talking to Pat Rehmer. She's the Senior Vice President of Hartford Healthcare and the President of the Behavioral Health Network. She's also a nationally recognized leader in mental health, mental illness, and addiction. We encourage you to ask a question here on Facebook Live, and it looks like we do have a question here. Let's see. Looks like ticket specials for those with mental illness on a very tight budget. There is a phone number that you can call. It's 1-855-HHC here. We also have information about ticket sales and everything about the musical on our website. It's hartfordhealthcare.org/normal. Also, if you are in need of services for mental health, there is the number 1-855-HHC here. We can tell you about all the services that Hartford Healthcare has to offer. So if you have any general questions about mental illness, feel free to ask them on Facebook. We'll do our best to answer them. Pat, want to talk about Talkback Tuesdays. This is also part of the sponsorship with TheaterWorks. So again, this musical runs from March 24th, this Friday, all the way until April 30th. And every Tuesday in April, there are talkback sessions with experts like Pat and other folks that we have at the Institute of Living and across our behavioral health network. This is a chance for immediately after the musical to sort of an intimate conversation to talk about these issues with the audience. Your talk is coming up on April 11th. What will you be delving into?
So my talk is the person with me will be Kathy Flaherty, who's the Executive Director of Connecticut Legal Rights Project, a woman who is in recovery. She and I are going to talk about stigma and discrimination. What has it been like for her in her life? How can we combat this? One of the things I know Kathy will talk about is the fact that while she has a mental health diagnosis, she's more than that. She's an attorney, she's a wife. It doesn't define who you are. And I think that's something that is changing and we need to continue to work on.
And I want to talk about treatment. And across the behavioral health network at Hartford Healthcare, there are a plethora of services from addiction to mental illness. Let's talk about the primary care practice, because this is often the gateway. This is often the front door where things are missed, but we're doing something about that. Talk to us about what we have sort of embedded in the primary care practice.
Right. So about 18 months ago, we started to look at putting behavioral health specialists, social workers, health psychologists, people who had worked in the field into primary care offices. And so what we have seen is that physicians may know, primary care docs may know that there's something that is interfering with a person's treatment or their response to treatment, and yet they're not sure what it is. And So we have a behavioral health specialist that's right down the hall that can see that individual and do a brief assessment, and then a physician psychiatrist backup to talk with the primary care physician, for example, if there's medication that they think can help. I think the most exciting thing about this is we're tracking outcomes, which is very important, and what we're seeing is a significant increase in better medical outcomes. So this isn't necessarily about the behavioral health outcome, although I think we're impacting that, but how we're seeing it is better outcomes with medical issues, decrease, I think we're between 37 and 40% decrease in individuals' visits to an emergency department, which is really important. We don't want people to have to go to emergency departments unless they really need to. And so this work has been proving what I think people have thought all along, which was you really have to take care of the whole person, and that a mental health or substance use issue is part of that individual's life too.
And just taking that back to the beginning, these are probably folks who wouldn't have known, or, because you're sort of starting, you go and you have your physical, you go to your primary care physician every year. These are people that would have gone in, had their physical, gone out, and then wound up in an emergency room but now we can track them. We're getting that at the beginning, sort of at the core there.
Right. And again, we're seeing better outcomes in diabetes, we're seeing better outcomes in high blood pressure, in obesity, a number of different areas that really are very important. And I think that the primary care physicians love this as well because their patients are getting better. And these aren't necessarily people with very serious mental illness issues who may have already been in the system. These are people that are typically, struggling with an anxiety issue or a little bit of depression that may be, in fact, directly related to a cardiovascular disease, because we do know sometimes people do get depressed when they have a cardiovascular issue.
Yeah, and it's important that primary care physicians and even other physicians recognize these signs, because it can affect other areas like you mentioned, cardiology, and they're better able to treat their patients too. Right.
And it's not extra time necessarily for them, but there is available help. One of the things that was true many years ago, and I don't think it's as true now, but to get primary care physicians or pediatricians to do some of the very basic screens was difficult. And what they would say is, if I screen someone and they end up having a depression that needs to be treated, where do I refer them? And so I think building up our system, building up places for people to refer to, or being able to treat them right there in the office is really a significant change.
Addiction too, and one of the Talk Back Tuesday session is on opiates, and we've seen an unfortunate rise in the number of opiate-related deaths. Let's talk about our match program. We are out there in the communities, in the suburban communities, because this does not discriminate. This is everywhere, unfortunately. And we have these medication-assisted treatment facilities close to home where people can go and get treatment. Talk to us about the match program.
So we have that. We're putting them up in many areas. We have one in Cheshire and Glastonbury. Our newest one is in Avon. These are really programs that are designed to do, for example, an ambulatory detoxification. So rather than having to go into the hospital to have that, if you have the appropriate supports at home and you feel like you can do this, then we have psychiatrists who will prescribe medications and see the patient every day while they're detoxifying. Then we use a lot of medication-assisted treatment. There's a choice with that, which is really critical. People get to choose what they want to do as they're being treated. But we do know that individuals who are on Suboxone or Vivitrol or methadone, although we don't provide methadone at our clinics, there's really at least an 87% chance that they'll be more successful in remaining clean and sober. And that's important. It doesn't mean they have to stay on the medication for the rest of their lives, but it's important to get to those brain changes that occur after about 90 days and beyond for some people. These addictions, opioid addiction is a very strong addiction, very hard to combat, and certainly not something that most people can stop themselves.
Yeah, they need help, and,
Right.
and help is out there.
Yes.
What do you say to someone watching us right now who might be in that situation that has that stigma, oh my gosh, this can't be me, or is facing some discrimination as a result? What do you say to get them to make that call? Because like I said, there is help out there. You don't have to live with this.
Right.
What do you say to that person or a family member who might have someone that they want to help get into treatment?
Right. That's a really important question. We know in this country that only about 10% of the people with addiction actually get treatment, which is a very sad statement. Now, some people can and do stop drinking, for example, without going through a detox, although it can be very dangerous. Alcohol withdrawal is probably one of the most dangerous withdrawals. And so it is important to at least seek perhaps your primary care physician's opinion. But again, we have match clinics, and we do treatment in all of our facilities, and we have a wide behavioral health network. I think making the call to get started is the most difficult. And if you're a family member, it's really important that you understand that you may really want your son, daughter, mother, father, whoever it is, to get clean and sober. That's great if you can help motivate them to make that call. And they don't have to hit rock bottom. People go into treatment at all different phases of addiction. But they also have to want, going in for treatment for substance abuse, certainly, is a voluntary issue. You have to be willing to do that. You may not think you can do it. You may not want to do it terribly, but if you can get into a program and see that there are a lot of people like you out there who are going to be there as well, I think it's helpful.
But I think it's a real struggle on the family aspect of it, who sees a loved one, sees that they're hurting, that they want to help them, but they just don't want to help themselves. And that's got to be so incredibly difficult and sad for a family. How do you sort of navigate?
I think that you have to have a lot of talks with the individual. You really have to try and help them understand how this is impacting their family, how this may be impacting their work. Maybe they've lost a job. Maybe they're homeless at this point. One of the things that we do see is people with these chronic illnesses can get disenfranchised from their families because they're not ready to seek help. But if you have a supportive family, and if you can encourage that individual to think about treatment, I think that that's the first step. And it doesn't work for everybody the first time. It does for a lot of people, but relapse is also sometimes part of the issue. And so the other thing is to not shame people further. Believe me, people who struggle with this issue have enough shame themselves.
And there are some that do come forward, and they are visiting our clinics that are in Glastonbury, Cheshire, and Avon. Cheshire and Avon are recent, but Glastonbury has been there for a while, and people are attending them because you're seeing it in the numbers.
Right. And the other thing that I think is helpful about these programs is that we also run them in the evening, so that if you're actively employed and you don't want to take a leave of absence, you don't have to. We can do, again, an ambulatory detoxification. We can work with you around staying employed. You can certainly stay employed while you're taking some of these medications that we prescribe. And so it really is, and you don't have to drive that far, right? So if you're living in Avon and you want to seek treatment, it's probably easier than having to come into Hartford or to Meriden or to Middletown, where we have treatment facilities. But this is an opportunity to get people into where they live.
We're talking with Pat Rehmer. She's the Senior Vice President of Hartford Healthcare and the President of the Behavioral Health Network. Also a nationally recognized leader in mental illness, mental health, and addiction, which is so vital. Let's talk about bringing this sort of closer to home in these suburban areas, because we are seeing folks from these middle-class towns with drug dependency issues.
Right.
And we attribute that to, is it prescription medication? What can we attribute that rise to?
We do think that a great deal of heroin use and abuse is preceded by opioid medication that has been prescribed, often by a physician, maybe not for that person even, maybe for a family member, but often it is for that person. And it does relieve pain. It relieves all your pain. Yeah. And so that people feel so good. Sometimes I joke, and it's not funny, but you feel so good mentally when you're taking this medication that you don't experience the pain. That's really dangerous. Yeah. And I think we have in the United States turned to pain medications a lot and often. The most pain medications, opioids, are certainly in this country. And we've gotten to a point where people don't want to experience their pain. I have not been at any kind of social event in the last 6 months where somebody has not approached me and said, usually very quietly, my son, my daughter is struggling with opioid addiction. What should I do? And sometimes people find out very late. They find out because there's money missing from the house. Right. They find out because the individual's behavior has changed so drastically. It's really a shock to some people because, again, there is this belief that not in our family and right. certainly not in our community. There's not a community in this state that hasn't had at least 1 or 2 individuals in treatment for substance abuse. If it's only 10% of the population, think how many more people are in each of those towns and cities in Connecticut.
What can parents do if they have children and they know in their family that there's either a history of mental illness or a history of drug and alcohol abuse? What can they do with their children as they raise their children mm-hmm. to sort of keep them away from that, knowing that there's a family history and maybe some addictive personality traits there too?
Well, I think first of all, let's not get into the place where we think our kids are not going to get into this just because they live in a wealthy suburb. Right. I was doing a community forum recently, and somebody who was from the town said, oh, our kids don't struggle with that. Well, that's just not true. That's not what the numbers are showing us. Mm-hmm. I believe that given that we're seeing 14-year-olds and 15-year-olds who are dying of overdoses, these conversations with your kids have to start no later than middle school. And I think you really have to have, one of the ways I have older children, one of the ways I used to talk to them was in the car, turn the music off. They're a captive audience. They kind of have no choice. And you need to make sure they know about your family history. Or if they've seen uncle or aunt, falling down at a Christmas party, that you say, that's something that you could end up with if we're not careful. It's not a one-time conversation. I talk to my kids about it constantly, probably to the point that it was annoying. And that was before this epidemic hit.
Right.
And I'm very glad that I did. Mm-hmm. We have a family that's genetically loaded. I wanted to make sure they had all the information that they could have to make sure they were making good choices. And that's what I said to them probably often, if not every time they went out, make good choices. Mm-hmm. And it's really important that they also feel they can come and talk to you if they've made a poor choice.
And conversation is so key and so critical nowadays, often because we don't converse with right. anybody. We're on our cell phones, we're
right.
on tablets. No one talks anymore. And this is a vital conversation mm-hmm. that parents should be having with their children mm-hmm. if there is a family history or if there are addictive traits.
Right.
And that's key. And a lot of it is education.
Mm-hmm.
A lot of it's communication.
Mm-hmm.
A lot of this is almost so simple to combat this, but yet we don't do it. The stigma's still there, the discrimination mm-hmm. is there. Mm-hmm. And again, that reverts back to education and having discussions.
Mm-hmm. Absolutely. And again, if I think about my parents and their generation, you didn't talk about any of this.
Right.
It just
right.
wasn't acceptable. It's
mm-hmm.
it's still not to many people that age. But everybody knows it when it's going on in a house. It's not the secret that people think it is. And actually, it's asking your kids or your parents to keep this kind of thing, quiet. Don't talk about this outside the family. That's what leads to the shame.
Right.
That's what leads to those feelings of, oh my God, look what I've become. Mm-hmm. It's not good.
Yeah, we need to do the exact opposite.
Right.
We've talked about the stigma. We've talked about the discrimination. We've talked about treatment options. Let's talk about the wellness, the recovery, and the hope, because there is hope. You can get past this. This is not something that you have to live with. There is help, and there is a recovery process, which is a vital process.
I think one of the things Connecticut is truly very lucky about is that we have a lot of advocacy agencies in the state. We have a lot of people who have decided very deliberately to, if you will, put a face on recovery, and that's what they talk about. And when you have people that are out there working and talking about being in recovery and advocating at the legislative office building around issues that are important to them, talking with people, other young adults who are struggling with this, it's a very effective tool, if you will, to combat this. It's why we think that in any mental health setting, in any substance abuse setting, there should be people with lived experience who are willing to talk about that with the individuals who are now perhaps starting their own recovery, to know that, oh, this person has been in recovery for 20 years. It's possible. And to really have people talk about their experiences.
And there are so many people out there that are upstanding members of society that have gone through the issues and have come out on the other end. And it's important to highlight that and for others to see that, to say, you know what, that could be me.
Right. Again, if you go to the C-Car walk in Bushnell Park every year, there's literally thousands of people who are out there saying, I've been in recovery for 20 years, or I've been in recovery for 6 months. But they're there. And that's really critical, I believe, for people's recovery, that they have access to people who have been through this, who know what it's like, and can support them and encourage them.
And are you always in recovery? Is that lifelong, that you continue to be in recovery? You can do well and you can get past it, but you're always in recovery, right?
That's right. And you always, I've seen people who have had 15, 20 years of being in clear recovery, who have gone into the hospital for some sort of surgery and end up addicted again. And it's really very sad to watch. It is somewhat more difficult every time that you sort of get back into that addiction to get yourself out of it, even with help. So to believe that you're safe after you've been clean and sober for a period of time, I think is something that people need to really look at themselves, talk to people, and remember that this is a chronic relapsing disease. Doesn't mean everybody relapses. I don't want people to think that, but you're at risk.
Is that when they relapse like that, is that when the brain function changes again and it kind of reverts back?
Right. I don't know that happens overnight, but we do. You do see brain changes relatively quickly, and I think that's how people fall back into this, and it's hard to get out of again.
Yeah, and it's almost like they'd have to start all over again, right?
Well, and then again, you get back to the shame. So my family knows that I've been sober for 20 years, and all of a sudden I've had a slip, which people don't like to call it a slip, but if you think about it, sometimes that's what it is. And do you really want to tell your family that you've gotten back into this? It's really hard for people.
And especially if you're established, too. If you have a job and then you're doing well and life is going great, and it just takes that one moment to turn it upside down again. So I would imagine that's a real struggle for someone who's been doing well for, say, 20 years. And then all of a sudden, their world comes crashing down again.
Which is why it's so incredibly important that people come out about this and talk about it, because it helps keep you accountable. Honestly, if you've been in recovery for 10 years and nobody at your workplace knows that, I think it puts you more at risk. How many times do people at work say, let's go out for a drink after work? But here's the other side of that. Don't assume that somebody who's in recovery doesn't want to go out. They may not have a drink with you, but that doesn't mean that they don't want to interact with you, be a part of the group. A lot of people can go out and do just fine in a setting and not drink. It's not that uncommon. I think that if you have a substance use issue, you believe that everybody else can see it, and they can't.
Mm-hmm.
And you believe that everybody, when you go out, is going to be drinking, and everybody has wine with dinner. That's not true. Look around a restaurant. There's a lot of people that aren't drinking.
Right.
And so we have to also re-educate ourselves and people who are looking for recovery in that it's not as uncommon as you think.
And be mindful of that and be sensitive to that fact too, that,
Right, right. If somebody says they don't want to drink, don't buy them a drink anyway and just send it to them.
Right.
A lot of people are not comfortable saying, I had a drinking problem, or, I hear people say funny things, I've had enough wine in my life to last me the rest of my life. Okay,
right.
That's pretty clear.
Yeah.
And that person's clearly comfortable saying that.
Mm-hmm.
So again, the idea that, it's more fun when you're drinking, or you're more interesting when you're drinking, usually not so true.
Right.
Especially if you drink to excess.
And with mental health, though, it's a little bit different because, you're not involving just a drink or a drug. I mean, this is just something, this is, something internal. This is how the brain is thinking. So that's a little bit different when you're trying to live in the outside world.
Right.
And sort of dealing with your demons at the same time, right?
It is different, but again, I think we are moving along in terms of people being much more upfront about those issues. We have a lot more discussion these days about the impact of trauma on individuals. We have there are support groups for people with bipolar illnesses, for people with the diagnosis of schizophrenia, for the families of people with those diagnoses. Support is so key in any of those issues, in any of these issues. Substance abuse, mental health issues. How do you navigate the system? If you go to those support groups, people have wonderful ideas and experiences, and it is helpful to see other people who have or are experiencing the same thing you are. That's just human nature.
Because it is overwhelming. I would imagine once you finally do get that loved one or that family member to seek help, it's like, where do you begin?
Right.
It's also that access to care too.
Yes. Access to behavioral health care is increasingly important. Certainly during an opioid epidemic, we need to have access as quickly as possible. One of the things we know about people who struggle with substance use issues is when they decide, this is it, I want to get treatment, if you don't have access, you can miss that moment, and that's a very important moment. It's one of the reasons we try to do same day or next day admissions to our programs so that you don't miss that moment. Now, can we always do it? No, because sometimes our beds are filled. But then we can try and keep in touch with that person and let them know when a bed's going to be available, or in some instances, start them in an outpatient program and see if that works in the meantime, or it even works enough so that they don't have to go inpatient.
Right, and that access to care, the well-coordinated care, and then the follow-through, I think are three critical steps in terms of getting someone through on the other side toward recovery.
Right. Those things are absolutely critical. And again, support from individuals who have this lived experience, who know what it's like, I think is also a critical component.
And knowing what it's like would be a good idea to take part and actually sign up to buy tickets to see the musical Next to Normal. It actually starts this Friday, March 24th. And if you can't make it Friday, it's going to be going all month of April, right up until April 30th. It's about a suburban mom who struggles with the effects of bipolar disorder, who has a daughter with opiate addiction. It's sort of everything under the sun wrapped up in one musical. So we do encourage you to go and see that and also take part in those discussions every Tuesday in April, immediately following the musical with Pat. We have other experts, Dr. Craig Allen, who's medical director at Rushford, Dr. Hank Schwartz, who's a psychiatrist in chief at the Institute of Living, will be talking about wellness and recovery. Dr. Allen will be talking about opiate addiction. So really great, important, heavy topics, but certainly ones to tackle. Pat, thank you so much for sharing your time with us. We really appreciate it. We thank you for tuning in and watching. We hope we can help you as well. If you have a mental health addiction or crisis, do call 1-855-HHC here. Thanks for joining us. We'll see you next week.